Hi, good evening, ladies and gentlemen. My name is Alfred Wong. Today we're going to be doing something a little bit different. It's holiday season soon, so we thought it'd be nice to do a Christmas special. Today's topic, we're going to be talking about from chaos to calm and how medical office assistants can help doctors with the burnout crisis. And today I have two special guests with me. I have Dr. Laura Hume, who is a family physician for 13 years. And we also have our very own Ashley Rahiman, who is Cortico's clinic advisor consultant. But today she is going to shed her hat and talk about her experiences as a clinic manager. So, welcome, both of you. And we're just joking just earlier, talking about this as the show, the Cortico show. But yeah, let's kick things off. I'm curious. This topic, both Ashley and I were thinking about, what's interesting that doctors want to hear. I saw a statistic earlier this year which talked about doctor burnout crisis, where I think it was like 45% of doctors feel that they are overwhelmed with paperwork, with not enough pay, and just from your experience, Dr. Hume, how has how have you managed the burnout crisis?
Yeah, for sure. I think there's a lot of burnout amongst us, and it's very prevalent. I think the paperwork is a huge thing. The chart writing, note taking, everything's up to date is a big part of it. The models are helpful, and I think it's great that our time spent working, not just face to face with patients, is now being recognized, which is a positive towards alleviating the burnout. Um, I think yeah, I mean, there's a lot to do in a day as a family doctor, and patients, sure as many of the needs are met as possible. Um, can be mentally taxing, emotionally taxing, and it's easy to burn out as a family doctor.
I'm curious because I'm not a doctor. I'm not a medical office administrator, but I'm really curious to hear what has been your most chaotic situation.
Oh, there's been a few, probably a couple of quite different ones. Once as a very early family doctor back in the UK, running around, very busy, running late, finished morning clinic, about to do 3 or 4 home visits, running back down the stairs with my tray of prescriptions that we had to sign manually and fell down the stairs. Everything went flying. And,
I'm not laughing.
no, because it was very embarrassing.
That's
One of
so embarrassing.
the partners was coming back up the stairs, and he was like, "Are you okay?" I was like, "I'm fine." Just crack on. That was one of the more comedy episodes. Otherwise, just generally the most chaotic days tend to be the ones where there's a lot of patients and there's a lot of issues per patient. Um, as an introvert, the input can be quite a lot sometimes being a family doctor. And if you're getting 3 or 4 issues per patient, you're seeing 30 to 4 patients a day. That's over 100 issues that you have to think through in your mind. You have to go through the history of the exam, the red flag noticing, the coming up with a management plan, explaining that to the patient, and then doing that many, many times over is gets pretty exhausting. And by the end of the day, you just feel like your brain is fried and well,
Why are doctors burnt out in BC? Like you practicing for 13 years in BC, I would want to hear it, but like, why are doctors, why this crisis, why now?
I think it's probably been going on for a long time. I think the nature of the job is prone to burnout. Um, it's the longitudinal care that we provide important. It's wonderful. I love being a family doctor. It's a fantastic job. It's a privilege to get to know. They become like an extended friendship group. I really, um, but I think in the lack of family doctors, the knowing that there's always patients, the family doctor, that part of the part of our role as well, wanting more, trying to take on more, taking on more, but then it's too much. Um, Work is a big thing, as already mentioned. Just trying to do a good job, really. The inequity, the pay specialist is a big thing, and then new family docs coming into practice, perhaps avoiding the longitudinal family practice care pathway and options. Um, so I think it's very multifactorial and nice that that's that was a big one in the UK. But I think there's lots of different help.
Hmm.
Dr. Hume, if you don't mind, the microphone, could you put it a little bit closer?
Yeah.
Yeah, great. You mentioned that patients see you for a number of different ailments. Have you noticed a trend, either from UK to here, or in more recent years that patients have maybe there's because of lack of family doctors or lack of medical service? Do you feel that there are more patients coming to see you for a number of different ailments?
Yeah, and I think there are. I think it depends on patient education and the demographics of the patient population as well. Um, the age group for sure. The the issues that patients come with are varied. They come in for anything from top to toe, and could be anything. And that's one of the wonderful things about the job. We're generalists. It's very interesting. Um, Most of the time, cough and cold season is a bit less, varied. But um, yeah, I mean, they come in for all kinds of things. And with regards to patterns, I think there's so many different patterns. It varies with time of year. It varies with media. Ozempic has been a big thing lately. COVID was obviously a thing and still is. Flu season, people wanting their flu shots. There's a lot of patterns for sure. Um, Even sometimes with medicine, and I suspect a lot of other family docs have noticed as well, that it's funny, things come in groups. You'll see a very rare illness that you haven't seen for ages, and then suddenly you get three of them in the space of a month, and you're like, but that's less of a pattern, just of a kind of a.
Is it usual though? Like, is it usual for you to see those patients who have multiple ailments at the time of the consultation, or are you aware of it before? I guess it's sort of a leading question because I'm sort of curious. What would the medical office staff, how could they have helped to minimize that, or at least plan out your day? Because I'm certain like it basically takes more time for the consultation, and everyone sort of gets backed up throughout the day.
For sure, and patients have issues that they want to have dealt with, and they've been waiting a period of time to see you. So I can understand why they come in with lists. I think also sometimes if patients are booking appointments during the period of time between booking the appointment and seeing us, other issues come up. So they're like, oh, by the way, this happened since I booked. Can I talk about this too? Which is fine. But I think to help with the boundaries around that, one clinic I worked in, a good thing where they put little pieces of paper on the desk. The MOA would say to the patient, do you have more than one issue today? Yes or no. If there's a yes, please can you write down your issues on the piece of paper for the doctor? And then that helps us just quickly glance through it. That avoids the issue of, as they're leaving the room with that hand on the doorknob, after 5 issues, oh, by the way, I get chest pain when I walk up a hill. And you're like, no. So I think trying to find out at the start of the appointment what the list of issues is, and saying to the patient, we've got 10 minutes. I don't think we can deal with all of these today. These ones seem important. Which ones are important to you? Let's do those. And I'll book you in for another time and we'll do the other ones. And often patients are very receptive to that. I think they understand this time constraints. And I think as long as you communicate, but definitely the MOAs can help with that. And, say, hey, do you have more than one issue? Or even, do you have any forms today for the doctor? Or, they could pass them to us before the appointment, glance through them. I think.
So you mentioned that you book the patients, the follow-up appointments.
She does it all.
Yeah, no, I don't. Sometimes I do, yes. And I think that's probably a lot of us do that as well, just for ease and trying to get things done. But that adds to the burnout, right? So if there's one less thing we can do, I am a bit guilty of not saying to patients, okay, go back to the front desk and book in for next week. I'll just get the schedule up and say, okay, well, let's see what we've got next week, which takes up, and that time adds up. So I think it's important for us to perhaps put boundaries in place for ourselves as well. It sounds like a little thing, but all these little micro jobs through the day add up, right? So it's.
So I want to pull on that thread just a bit because, like, Ashley, you're a clinic manager, you're former clinic manager.
Former, hopefully last.
um, but how would you respond to that? Like with Dr. Hume saying that out of convenience, she would sometimes, or in many occasions, I'm sure you would book the patients for the next follow appointment. How would you respond to that?
I would say great. I'm getting paid for my doctor to doing my work for me. I mean, why not? You're doing everything. I'm just sitting there on TikTok. No, I'm just joking. Um, I mean, I don't think she's mentioned it, but she's opening up her own practice coming January, both of us. Um, and since I've known her, she's been booking her own appointments when she's working from home. So I get really confused why, and I get kind of sometimes aggravated. I'm like, your MOA should be doing that. You know, you're paying an X amount of dollars on, overhead. Your MOA should be doing that. But 100%, it's so important to have a good front desk manager orchestrating the front desk of the clinic. Patient comes in, patients, everyone's coming into the clinic because they need something. They need help, they need to get better, they want to feel better. And coming into a chaotic clinic, you kind of reap that energy, right? Like if someone's burnt out, you are kind of coming to seeing a doctor for anxiety and my doctor has anxiety or my doctor's burnt out, it's kind of discouraging, right? Like it gets crazy and stressful. So it's so important to have good staff in the front of the clinic, managing that patient that's coming through the doors, making sure that, do you have any forms that need to be filled out? Is there anything else that you're coming in for? So as long as that front staff member can figure that all out for the doctor before that patient gets seen, then it's a smoother appointment for both patient and doctor. Um, so yeah, like catching all those important things, those little tedious things that doctors sometimes get aggravated about. If the MOA or front staff can catch all of those things, then it's a much easier appointment for you, and you're not pre-booking another appointment. I mean, there's so much tools that have been incorporated since the pandemic. There's software that's been, I mean, Cortico. um,
Shameless
Cortico.
plug.
I'm not
Shameless plug.
selling anything. I'm just saying Cortico. But anywho, there are important tools that that have been implemented since the pandemic to take away tasks for the MOAs, so they can catch important tedious things that um, might, stress you out. So we want to take all that burden away from you. We want to take away all that tedious paperwork. So all you have to do is the clinical description. Like we want to take away, things that are due. We want to take care of all the office supplies. So you're not, running around, looking for alligator forceps. You know what I mean? Like we want to take that away from you. So everything is prepped and ready to go, and you have that calm setting with your patient, right?
Can I interrupt for just a
Yeah,
second?
go ahead.
Because, and again, apologize to the audience because I'm actually multitasking a lot of things right now. And so Matt from our team has told me that the chat function isn't working. So if you have any questions for Ashley or Dr. Hume, there's the Q&A part where you can type questions in. I do have the chat synced up to my monitor here, so I should be able to see all the questions that come in, but I just wanted to let everyone know that. Ashley, I want to pull on something that you said. Talk about forms.
Yeah.
In the past, when you were a clinic manager,
Yeah.
Obviously there wasn't as much technology as it is now.
Yeah.
Knowing the landscape of technology with forms, how would you suggest Dr. Hume sort of handle that patient booking process where it streamlines the way that patients book in, so it minimizes, or at least it staggers the patient consultation, so that they're seeing, instead of coming in for
Yeah, I mean, like I said, I mean, like there's tools that have been implemented where, I mean, things like forms, like, for chronic complex patients, mental health, there's lots of forms associated with different types of diagnosis. But if, we can prep and, like say, for example, say somebody comes in or is coming in for a mental health assessment. and you don't know that patient and you have no history, but that patient's booking. There's simple tools that have been implemented where that patient can be sent an intake form to fill out prior to the appointment, right? So you have tools, and you have that form in front of you, and you know what to expect during that first initial visit. So I think forms, like having simple things like forms, intake forms, subsequent forms, uh, tools where patients can upload, specialist consults from back in the day, so you know what you're going to be dealing with. So to answer your question, it's critical, and I hope you do incorporate that in your future clinic.
Yeah, for sure. And you can organize the pre-appointment information. So if the patient picks on a mental health issue, then add 7 questionnaire or PHQ-9 or something like that they could fill out prior, or if it's a well baby check, they could fill in the 1 year checklist for the child, which can help a lot with the timing during the appointment. Yeah, I agree. I think it's helpful.
I have a question. What do you think, like, to prevent or maybe to alleviate the burnout crisis? What are your thoughts of the doctor and staff? Like, what do you think that they can do, say, before the clinic opens? Like, what would you want? Like, what do you not want to bring from your current clinic to your new clinic?
Yeah, I mean, I think in the current clinic, there's a lot of clinics that do prep things well. I think teaching your staff about what you require for the appointment. So personally, for a physical or a PAP, I like the patient changed, I like the blood pressure done, the height and weight for the physical. I'm ready to go once I'm in the room. It's the hard thing if you've kind of been reading through their chart, you're 5 minutes into the physical because you've been trying to get everything in order. You go into the room and they're fully clothed with nothing done. You're like, oh,
Hold on.
no.
Okay. Hold on.
So, but that's a staff education thing, right? And a communication thing. So that helps with the workflow. And I think workflow is a huge part of the way to remedy the burnout and reduce the burnout. So, and by workflow, I mean if there's a physical or a PAP or something that requires an examination, is the patient prepped in the room? Is the equipment there ready to go? The room stocked even? Are there cotton balls? You've just done a shot and vaccination. There's no band-aids or cotton balls. So little things like that actually are quite important and irritating if it happens time and time again. So the stocking, prepping the room, prepping the equipment for the patient, prepping the patient. If you have a busy day, it's good to look through the schedule, and I guess you can put it together, but looking through beforehand as an MOA, seeing what might be needed through the day and when. And also, if most of us work out of 2 rooms, if one of my rooms is empty and I've got 3 patients in the waiting room, I want that next patient in the room. I want to keep going, fill up, and the workflow is fun.
But if MOAs, and I mean, I'm advocating for all my MOAs out there, the only reason that happens is because, not the only reason, but I would say 7 out of 10 times the reason why things are being forgotten is because the MOAs are burnt out. And I know that BC or Canada is all about, doctors burnout, which I take very seriously. I have a lot of friends and colleagues that are doctors, and I give it to them. Like, I can't believe sometimes what they go through, including you, is that the MOAs are burnt out, and no one's talking about that. I haven't heard nothing on Doctors of BC. I haven't heard nothing about anything about the MOAs being burnt out. And I mean, I've been there, and I've been in chaotic settings where it's cough and cold, it's flu season. I got, 3 walk-in doctors. They're all capped out. It's only like 11:30 and patients are still coming in. And I can't say no to a crying baby. I can't say no to a 90-year-old person with whooping cough. Like, I can't say no to that.
So what's your most chaotic story?
Oh God, you don't even want to know. At one point, I don't know if I can say this on live. I shouldn't.
It's a safe space here.
There was a time when, I mean, oh my God, I can't believe you guys are letting me do this. Okay. There was a time, it was flu season, and it was right after, I think it was like just right after Thanksgiving. And I had two doctors. One was stuck in traffic coming from Vancouver. I had two doctors that were at full capacity by like 10:30. They were fully booked. And
So 50 patients.
God, yeah, 100 patients in the queue. And I had a waiting room area full of crying babies. I had, people's grandparents and coughing, and I had a patient that came in and just smelled so bad, and we don't know what it was, but it was so bad. It was, oh, I can't even describe the smell, but it was so bad to the point where we were all working under that smell till that patient was seen at 3 o'clock. So you can only imagine. But anywho, I would say that was my most chaotic, or most chaotic day. But there's been plenty, but that sticks out. That smells out.
Let me ask you a slightly different question related.
Yeah.
What has been your most memorable situation
Yeah.
where your burnout or your MOA staff were all burned out because of the doctor?
I had a doctor that, I mean, I've worked with I would have to say I've worked with over 60, 70 doctors. And I would have to say I had one doctor that had a really bad attitude. And I mean, I could work with him. I can work with anybody. I have brothers and cousin brothers, and I could handle it. But again, my poor staff couldn't handle it, and other doctors couldn't handle it. And it was just, I had to talk to him. I had to talk to him and be like, hey, you just can't talk to people that way. You can't talk to staff or even your patient. And I mean, patients, you know what I mean? People are coming there to get help. They don't want a 10 hut type of doctor, right? They want someone that's soft with good bedside manner. And yeah, it was a bad experience. And it was challenging for me because I learned so much about that experience working with him. And, wasn't a bad person. I loved him. I loved him like a dad. But yeah, he treated everybody like a kid, and it was not a good setting, and it didn't work. So
Do you
it's
think
so,
he was burned out?
um, yes and no. Um, Burnt out, yes. But again, that it was during a difficult time. But I wouldn't say he was completely burnt out. But yes, he was in the process of shutting a clinic down and merging one practice with another practice, and I can see where that type of burnout came from. But I think it's very important as a medical director to work with the supporting staff. Like, I mean, I've opened a bunch of clinics where the title medical director is needed, but when it comes to practice the word director in the clinic setting, it's forgotten. And it affects us, it affects the staff, it affects the workflow of the clinic, it affects the environment. Like, no one wants to come to a clinic when it's scary or I'm walking on eggshells, right? So it's so important as a medical director. And I've worked with a medical director before the pandemic who was awesome. She was like a mother to everybody in the clinic, and she made sure everybody was okay. She'd come in and whisper, "Are you okay? So things like that, having that reassurance that you're taken care of, and you have a director that's kind of like a family figure. I mean, when I opened up a clinic, like when I do open up clinics, it's more of a family setting, right? Like everyone has each other's back. We all work together. Yeah, we're gonna fight and scream and yell, but at the end of the day, we're doing this together, and we're trying to make a difference in our community. So, yeah, just be calm and having your weekly huddles, and making sure that if things are needed in the clinic, stocks, admin. Equipment, anything that's needed, see how, most importantly, a lot of clinics forget this, like reviews. Your clinic reviews are important, you know what I mean? And if you have a bunch of people that are complaining about the phone, no one's picking up the phones, you got staff are rude or doctors are rude, like, why do you think, right? It's not always about the doctors being burnt out, because if the doctors are burnt out, the staff are going to be burnt out.
And I think it's really important to remember the LOAs. They've got a really tough job, and I
Yeah.
don't think I And the public facing, they're the first interactive, first person they see. Patients are either in pain or anxious or sad or angry or whatever, and the MOAs or the front desk staff get that. And as doctors, I think we do know that the MOA and the supporting staff get that a lot more than we tend to hold back if they're with us. They will let the frustrations out on the staff, which isn't fair. And I've certainly have said to MOAs, if there are any patients that cause you guys stress or issues, a recurring theme, I would want to know. And I chatted to patients, said, look, there's something happened. So I think it's really important for us to support the staff and recognize that there's burnout for them too. They have a tough job. And I think kind of coming to that, what you said about why is everybody, why are people angry or upset, or why are patients upset? I think a big thing that a friend once told me to always, and I always come back to, and it's really helped my interactions, understanding of other people, is the phrase seek to understand. So seek to understand, why is this patient upset with me? Get my back up, or I'd get defensive, or I'd be like, well, stop, have a different reaction. But when I think about that phrase, seek to understand, it's not personal. And if you try and understand where the patient's coming from, where the MOA is coming from, where the other doctor's coming from, what's happening for them to behave that way, it opens up some conversation. But I think it also just shows some empathy and makes the whole team work better. And
But how do you deal with patients who don't want to be rushed, or they don't want to take more time off work, in the situation that you described before, where they want to come in to see you for multiple things?
I just deal with the issues, get behind, honestly. So if patients, and some patients you do have to spend more time with, if they're depressive, suicidal thoughts, or something that, you're thinking about, there's maybe a cancer underlying here, I need to do a big workup for this, or, it takes longer than 10 minutes. Some things just take longer than 10 minutes. And that's the nature of the job. And I think often we run late, right? And I would hope that patients realize it's usually for a reason. Generally, we're not sat having coffee, chit-chatting. There's
Little do we know, just joking.
there is something potentially important going on, or the patient just needs more time. And that's where the constraints on family medicine aren't applicable sometimes and aren't practical. Some things we just can't do in 10 minutes, and that's okay. Like, run late, you catch up.
Yeah. So it's really important. That goes into workflow. Like, you should have, I feel like a lot of family doctors, they just book their patients anyway, Monday through Friday, 9 to 5. They just fill up the schedule. But I truly believe, and this is a different topic. This is a different webinar time where we can talk about this, a different show, but workflow, organizing your workflow. Like, I took pride in organizing every single family doctor that I had the privilege of knowing, organizing their workflow. Like, I used to have PAP clinic Wednesdays. Like, getting all our chronic and complex patients in before the whole LFP model changed. But having all those.
I apologize. My automated timer lighting off. So.
Yeah, so just having focusing on the workflow, like spending time, like as the medical director, spending time with your supporting staff that's going to be doing your scheduling. It's so important to know what's working for you, and then having an office manager with experience come in and be like, okay, well, do you know if you can maybe move all your PAPs to this day? You can open up your Thursday mornings to get all your senior patients in who don't like coming at the end of the day for all your prescription refills. So I think workflow management is super important, and it doesn't take a long time. Organizing this one family doctor's workflow, it took me about less than a day, but it was just literally sitting down, having coffee, and understanding how she operated, what was causing, what's the issues in your workflow, and what I, as an office manager at the time, could do to alleviate that. And I feel like a lot of times where, you can just hire a bunch of staff, but, an office manager just spending time with them and, hey, you got to do this, but like, that's not how a lot of people operate, right? And I feel like once the MOAs know how the doctors operate, so spending that one-on-one time, it's a quick 15, 20-minute coffee. It gives the MOA so much joy and importance, and they feel like I have a purpose in this clinic. Because it's not all about you. I'm going to say that. I'll be very blunt. It's not all about the doctors in the clinic. Sometimes it is, but it's also you want to make everybody in that clinic feel equal at the end of the day. Everybody wants to leave happy. Everybody has a family to attend to. And it's so important to spend quality time, just that 15-minute coffee break, that little huddle, and just understanding how the MOA operates. Like, what are the challenges that they're facing? Like, why can't you do anything right? Well, why do you think? And so it's just 15 minutes a week with just a one-on-one with your staff. It makes such a big difference. And you saying like, it's just so much paperwork and I don't want to, don't bring me the paper, wait till the end of the day. Things like that, like little tedious things, it makes such a massive difference. So hopefully I can help with that.
And I think the idea of having your day kind of organized, I don't know, it kind of makes me a little bit nervous. I've been fairly ad hoc with my appointments, what comes in, when it comes in.
Yeah.
The idea of kind of saying PAPs will be here, elderly patient will be here, I have to admit I'm a little skeptical, but I know you've done it before with other doctors, so I'm open to it. And I think it's good to be open, but yeah, I'm interested to see how that would work.
That's a very naive question because again, I'm not a doctor. I've never worked in a clinic before, but in software and a lot of companies, we do like daily stand-ups, right? Where we're for 5-10 minutes, we kind of talk about our days. Is that something that is useful? Because I think you mentioned that you might want to meet on a weekly basis, but meeting at the beginning of the day, just kind of going through the schedule together, is that something that would help sort of the team building and sort of minimize that communication challenge?
110%.
Yeah,
110%.
I thought you were going to say, is that something that happens? That's what I was saying. No.
It doesn't happen a lot.
But I think that would be great. I mean, looking at the schedule for the day and just, it can even just take 5 minutes sometimes if it's a straightforward day, but knowing who is coming in for what and when and just.
Because I'm sure there are going to be some patients where that they might be often coming in for multiple ailments, or they might potentially bring a family member in. Then having that initial, I guess, morning huddle helps sort of plan out the day, and maybe you as a doctor, you expect that to happen in the afternoon, so you might be prepared for it.
Oh yeah.
And maybe there might be things that the MOA could do to help resolve that at the front desk.
Yeah, for sure. I think it's worth trying, and if it becomes too much, you could always reduce it down.
I think it's because that you think that your patients won't be able. Like, I mean, I truly feel. I mean, I've had a sick grandmother. I've had sick family members. If people need to see a doctor, they will make the time for it. And I think that you trying to mix and match your day to day, it does cause burnout because you might have 10 complex patients one day on a Monday, before your end of the day. But I truly believe with proper workflow management, which I feel for family doctors that just fill up their day to day, but that's not proper workflow management. I feel like if you apply some proper workflow management, that it will decrease, it will make a difference. Like your Thursdays, for example, like between 1 to 3 before you come home, like that could be that time frame could be you doing admin work or catching up like your paperwork, but most importantly, getting your quick prescription refills out of the way. But yeah, like I feel like with more workflow management, you're going to open up more days. You won't have a week wait. You won't have a 2-week wait. So I truly feel like, I mean, I'm not perfect at it, but I think that communicating, having conversations, having those, coffee breaks together, anybody can, make it happen.
Have you had any situations, open question for both of you, where when back to the comment about family members who bring other family members for the appointment, MOA says no, it's only for one, but when they come into the room, the physician says, okay, fine, I'll see all 3 of you.
Happens all the time.
How do you resolve that? Or from a doctor's perspective, what would you want the MOA to do?
I think I've often told my MOAs, if somebody has something urgent, let me know and I'll fit them in somewhere. Especially babies and elderly, and if it is truly urgent. And I think that's also one of the privileges of having a family practice population that's under your care. They know how patients know how you work. Generally, they wouldn't take advantage of that, I feel. And generally, it is, they are concerned about their baby with a cough and a fever. And can you just see them today? Yes, absolutely, bring them in. So, and then I think for other things, if patients come in and they're with their kids, the appointment's just for the mum. They say, "Oh, can you just check this for my kid?" Often I will. And I think for the MOAs saying, I think the best thing for the MOAs to say, and it depends on the doctor as well. If they're very strict and say no, then that's the right thing to say. But if there's a bit of leeway, I think just the MOA should just say, ask the doctor when you're in there. I can't guarantee that they'll be able to see you. They are full. They may be able to do something, but ask when they're in there. And I think that does pass the buck to the doctor, but I think that's appropriate because we're the ones making decisions, right? And if it is somebody sick, they'll turn them away.
I would say 9 out of 10 times, like if I knew that the doctor was at capacity, I would just say kindly, we are at capacity, I can get you first thing in the morning. Or I would just go on, find another walk-in clinic or urgent care unit to get them into. I think it's very, very important as a family practice to never turn away anybody. Always send them somewhere. And that's like rule of thumb for me. Managing and operating a clinic is to never send someone without no information. They need to know, they need to be redirected somewhere. So it's so important to get to know your community, all the local other walk-in clinics and urgent care units in your area. Pharmacists can see patients with acute care. So hopefully we don't get that a lot. But I if we were in a situation, it's happened to me so many times, Alfred, where, the regular patients would come in and be like, oh, I got my daughter, my son, my grandkid. That used to happen all the time, especially when it was flu shot season. They would bring everybody in all at once, but we're either at capacity or I would respectfully send them to another clinic that's open, or now it would be a pharmacist that could see someone for acute care.
And I think that would come down to workflow as well. At the moment, my schedule has 3 appointments on the same day appointment slots. So if somebody's sick that day, they can phone up and I can put them in. They can be put in one of those appointments. So I think the workflow of the schedule, I also finish on a certain time of the day where I know that if I do have any extras, I can just pop them in at the end of the day, or I have a break in the morning and the afternoon, which I know I can fill, although it's nice to have the break to catch up on all the typing. But I think there's different ways around that to accommodate those patients that do have that, and it does come up. Yeah.
What about when maybe the medical team and the doctors are working flawlessly? You've communicated certain workflows that you agreed upon. Question to Ashley is that what if the doctor, they don't follow it? What if they don't follow the workflow? How do you manage that from the perspective of a clinic manager or
if a doctor came in and they weren't following the
workflow that they agreed to?
And in what setting, for that specific day with that doctor, or are we talking about a clinic that has multiple doctors, 3 MOAs, and 1 doctor not following the rules?
Whichever comes to mind.
Okay, so this is a prime example. It was a hybrid walk-in family practice, and I had a doctor that just did not care about time. So I'm not saying that they were spending time with patients and forgetting about the time frame of that appointment. I'm talking about coming in late to work. They're scheduled for 9, they're coming in at 11. So what happens to all those patients from 9 to 11, right? So I feel like if a doctor that did not take the workflow seriously and was, patients were getting upset and my MOAs are now getting burnt out and stressed out dealing with tardiness or whatever it may be, that's when I have to sit down and be a drill sergeant. And I'm sorry, but it is what it is. We're running a business at the end of the day, but also most importantly, we're entitled to help them. We're here to help people. We're here to help heal people. And we can't have patients who have been sitting in the waiting area since 9 o'clock to be seen by someone that's not in at 11, that's coming in at 11. So it's basically, for me, I can put my construction hat on and be a construction supervisor at that time. I can be pretty hard, but most importantly, I take my job seriously, and I would hope that, that type of doctor would take their job seriously, because if they don't and they don't care, then they don't belong in that clinic.
In that situation, though, like when you mentioned that the patient is in the clinic at
Yeah.
9 o'clock waiting for the doctor to come in who's scheduled to start at 11
Yeah.
o'clock, do you feel that now with technology being the way it is, with a number of online booking platforms like
Yeah.
Cortico,
Like Cortico.
Do you observe a lot of that now?
Well, I mean, I haven't really been in a clinic setting since, pre-pandemic, but what I can say is that if that doctor was coming in and they're late, they're stuck in traffic, and your first few appointments are phone visits, then just take them in the car, right? I mean, I heard from someone that you can access your EMR through a Tesla. So it's just things like that. Like if it's the first couple of visits, I mean, regardless, if you're coming in clinic, you need to be in clinic. If you're working from home, got to be in time. But punctuality is so important in healthcare that it gets forgotten a little bit sometimes, and it gets forgotten because of the burnout, right? So I take punctuality seriously, but in that sense, with doctors running behind, I feel like having phone appointments, telehealth appointments, mixed in a in clinic office setting, it does help. It does help. Hopefully, no one changes the fee schedule on that, but it does help, and I feel like
I think also just going back to the doctor that runs 2 hours behind all the time. I think also just that seek to understand thing, right? Have a conversation with them. Why are you? What's the
Are you okay?
2 hours late every day? Is there something going on? Is it, or are they just genuinely late to everything?
Yeah.
Is there something that can the workflow be changed? Can their day be changed? Can their hours be changed?
Yeah.
Is it too hard for them to get there before 11 a.m.?
Totally. You're right about that.
I think, again, a lot of it comes back to communication and effective communication, being open to hearing what the other. If it's genuinely not a fixable issue, then it's not. Often I think it is.
Yeah. It can work at the end of the day, right? Like like you said, if someone's coming in late, schedules can change.
I want to change the topic a little bit, and I'm curious to hear your thoughts about the LFP model, the fee service, specifically because there was an audience question about how do you deal with patient no-shows? What should we be charging patients a no-show fee? What has your experience been?
Generally, yes. I think it's important to have an element of respect for everyone's time, and that includes the patients having respect for the doctor's time. Generally, if there's a genuine reason they can't make it to the appointment, I mean, a lot of patients phone to say, and if they have a reason, try and let it slide. If they phone up afterwards for with a good reason, that's fine too. But generally, if there's no good reason, or if they forgot, or no, yeah, I would charge for a no-show, because not only is it the doctor's time, the clinic's time, the business time, it's also the fact that that appointment could have been taken by another patient that was in need. So I think it's important to get that message across to patients that, or maybe let it slide the first time, say, okay, this is the first time, here on out, if get or something, there will be a clinic charge for the no-show, but
That's in some disagreement.
No, I agree. But the thing is, the biggest pet peeve for family doctors or any doctor is talk about money in that exam room. Talk about, oh yeah, well, I'm not going to see you because you owe me $25 for no showing the last Thursday.
Anyway.
Doctor's pet peeve is that's the front desk job, and that's where it comes down to having someone orchestrate your front desk and to prevent that, right? And money is always a sticky topic, in a clinic setting. I always found, but again, like that's the front desk's job. They take that job, and it's never your job to talk about money in that in that exam room, because that the turnoff.
Yeah, it generally doesn't come up in the exam. It's dealt with before or after.
But the thing is, there's like technology that can prevent no-shows, right? Like sometimes I think that I don't know what companies, but there are companies that when someone is booking an appointment, they can, put in, pre-authorized no-show charges, right? So, that's a question, or it's something that you never have to talk about because they're going to be charged regardless. So
Technologies like that seems to be
no one's talking about it. It's the computer.
because I mean, coming from an outside view, like I can imagine that it's challenging for the front desk to even have that conversation if the patient is there and they're sick and
Yeah.
you're demanding, or not demanding, but you're advising that, hey, there's a outstanding no-show fee. Like,
You
would you actually
cannot
charge it?
you cannot tell a patient with, say, a single mother with a baby on a Saturday raining, thundery morning. You can't tell that patient, oh yeah, my doctor's not going to see you because you owe us from last Thursday for no showing. Like you can't, like no one can, I can't morally do that, right?
Yeah, we wouldn't do it
I
anyway.
can't.
Yeah. It really depends on the situation.
Yeah, it
I
really
think.
depends.
If you know the patient is just, you know, not very respectful or doesn't
Yeah.
care, then that's different to the patient that's really struggling or has something else on. And I
Yeah.
think it's very case by case. And most patients know the appointments, especially when they have to
Yeah.
wait a certain amount of time themselves to see you. I think they understand the preciousness of the appointment.
Going back to those tools though, for example, there's reminders now, right? Like MOAs don't need to call up patients, be like, hey, you have an appointment tomorrow, you haven't confirmed, are you coming or going? What's going on? So, but there's reminders that are set now. So if I do book online, or using a platform called Cortical, I don't know. If they are booking online, there's reminders that can prevent the no-show. So
I think that helps a lot. That's
yeah.
really reduced the no-show thing, because it's a horrible topic. I hate
100%,
it.
yeah.
No-show, and you're like, oh no.
Yeah.
So yeah, I think the reminders are good. And I was always of the mindset that patients are adults, they can have responsibility to remember their appointment. Why do they need reminders? But
technology, some people don't pick up their phones, miss
totally.
calls.
So I think reminders are helpful.
Have you realized that we've been chatting for almost 50 minutes?
Oh, have we? Oh gosh, that was fast.
No. Any questions?
Well, I sort of want to be mindful of the topic, right? I mean, we sort of covered quite a few things today on things that MOAs can help doctors manage their day, and we also talked about how doctors can manage their team and have more effective communication with MOAs and make MOAs life easier and manage the MOA burnout crisis as well. I just want to touch upon a couple, like, are there any specific like workflow examples that you can think of from your, like, I guess, drawing upon your experience before as a clinic manager to now, having seen Cortico, having seen all these different softwares out there like Ocean, what are some things that you would advise Dr. Hume on implementing workflow wise?
Organizing your day-to-day, meaning the way you see your patients, not the way you see your phenomenal doctor, but how you see your patients. Scheduling management is such a crucial thing to set up in your clinic. And if you don't know how to manage your schedule, then it's just going to be chaotic, right? And I feel like that's the whole key element. You have software that can take away all those tedious admin tasks, right? So that MOA is not burnt out answering the phone 10 times a day, being on hold. You got, patient coming screaming, oh, when's my turn to be seen and this and that, or where's my referral? How come it hasn't been faxed? Things like that. Like if you can have, automation that's implemented in that practice to take away that, then that MOA is your left hand throughout that entire shift.
And practicality wise, going to Alfred's question, how would you have a general outline for the
playbook?
Yeah, do you say, okay, half a day for PAPs, half a day for doing your prescription refills, bring your complex cares in?
I think yes. So the most important thing is to, either print out, download, or to categorize your patient panel. That's the most important thing.
Well, I think right now that sounds like a lot of work.
No, it's not. It's not. It's for you. It is. But the most important thing is to flush out people who you haven't seen in 3 years, because you're gonna be like, because it's gonna drop from 5,000 to 1,200. Let's just say. But you take your patient panel and you organize it. You have pie graphs. You see what you're seeing most of, what you're seeing less of, And it's just, it helps me, it paints me a picture of what your 9 to 5, Monday through Thursday is going to look like.
So that's where the EMR can come in. The EMR can come up
Yes,
with
100%. Every EMR can do that. And I think that once I have that in place, then test it out. I'm not saying that it's something that it's you're going to have to get used to, but test it out. See how you like it. If you notice that your month or your week is less chaotic than last year that day, then implement it, practice it. You have to religiously practice something in order for you to make it a habit. And I feel like people have a certain habit and it's so hard to break because you just want to fill in your schedule. You don't want any empty slots and you just want it full.
Change is hard as well.
But if you organize, so coming in Monday morning, you have 10 PAPs and you have, say, 2 speculums. What are you going to do? Right? So it's so important to organize your day to day, and scheduling management is massively
I
important.
want to raise something because, and it just crossed my mind because you mentioned like 5-10 minutes ago about having breaking up your day with,
Yeah.
with phone calls. Is this something that you would suggest? Where, for example, like the within 1 hour, the first 3 visits are in clinic visits, but even though you're at the clinic, you take your fourth or fifth appointment as a phone call.
Generally, phone calls are more efficient.
Yeah.
They're quite nice kind of catch-up slots. I find personally.
What I would do is, so let's just say it's Friday afternoon, I'm taking a look at next week, and I have patients, I have a list, say a written list of patients that are wanting to come in but can't come in because the entire week is full. People are coming in for prescription refills. Like, that's a simple phone call. They don't need to come in for that, right? So again, you can manage that by putting that on your website, saying if it's a prescription refill, you can book an appointment. But again, like, now that the pandemic is over, I don't know if it's 100% over, but I just think that every doctor is different. But if we can help, like with simple prescription refills over the phone, then that makes room for patients to actually come in to be seen. It could be a baby need to their.
I think as well, I know some doctors like to have the in-person days as all in-person appointments.
Yeah.
Work from home days,
Yeah.
all telephone appointments. So I think it's personal preference.
Yeah.
Personally, I like having the odd telephone call throughout my in-person day because,
Mhm.
like I said, it's a bit more efficient, a bit of a catch-up. But yeah, I think it comes down to what the doctor's preference is for their.
Yeah.
Communication, one thing we talked about,
Yeah.
which is really key. So, would it be something that you would be interested to explore to have that improved communication? Because again, like what Ashley was saying, like if you can see your month this month versus last month, and if there was a significant change in improvement of your mental health, your schedule, chaos, and you find that communication with MOAs streamlined, would that be something you'll be interested to sort of test out? And when you do test it out, then you can come back on the show and share your thoughts, because it's interesting. Like some of the comments in the audience have shared that there really isn't that communication between doctors and
People,
MOAs.
it's not just doctors. People don't talk anymore. People text. People, like, I mean, I miss going out and having, sushi nights with my friends. I miss talking. I miss, like, now there's group chats. Like, and the thing is, I mean, now that we're starting this clinic together, like, I'm a little bit fearful. Like, what? Like, is everybody just going to be texting? Like, I used to have, I would buy dinner for the clinic. We would all chill there doing notes and catching up on paperwork and, just having a good time together. But, like, I don't think people do that anymore. And I feel like since the pandemic, people don't talk, and people need to get back out there.
I
And
feel like it's almost going the other way with technology.
Yeah.
It's kind of taking over, and I feel like we're kind of a bit like a rubber band. We're
Yeah.
stretching out to technology, and then we're going to ping back a little bit and find a nice middle ground where we
Yeah.
communicate.
And I really stand by this. Like, doctors, if you're a medical director out there, if you are a doctor working for a medical director, or whatever it may be, you have no idea how much of a difference you would make if you just simply ask how you're doing to your MOA. to your reception, to your nurses, your nurse practice, anybody that's helping you at that clinic, just asking them nicely, like, how are you doing? Is there anything that I can do for you? It's going to change their day drastically, which is going to change the way of the clinic's energy. Yeah. Yeah.
So shameless plug of the Netflix show New Amsterdam. I think I've been watching it recently on Netflix.
Yeah.
And the main character always goes around and says, "How can I help?"
That's me.
Like
That's me, Laura.
How can I help? How I start my consult? How can I help today? Yeah.
So great conversation. We actually have a lot of questions posed by audience.
Can we zip through them?
We don't have time.
Oh, we don't have time
to go through all.
Okay.
Because I'm also mindful that this webinar is live for the folks on
in the East
time.
Coast. Yes.
But this is actually really interesting because this whole event, this whole webinar, was sort of designed in a way where we wanted to just have an honest conversation about what doctors, what MOAs are feeling, and trying to facilitate that conversation to see how Cortico, as a technology company, how we can be better, how we can develop more automation, how can we support more of the intake forms, technology, payments, etc.
Yeah.
And all of our prior webinars, if the audience has been in those, like our slideshows and presentations, they were kind of boring. So this event was sort of a way for us to
scenes.
it's
wine,
cookies. But seeing the number of questions that the audience have asked gives us the reassurance that we're talking about something that's really relevant. And I think this will be something that we could definitely do again.
Yeah.
But yeah, Dr. Hume, Ashley, thank you so much for being here.
Thank you.
Probably as closing, I do want to share that the Cortico team been working very diligently on creating some tips and tricks for Oscar users. We're going to be developing more material for Accuro users and other EMRs as well. So after this event, we'll circulate a follow-up email, and we'll provide a link to a free 4-day crash course on tips and tricks, how you can use tools, free resources to help MOAs, to help doctors be more effective at using Oscar. So keep an eye for that. Stay tuned for our next The Show. I mean, this really might turn into a regular thing. I apologize that we couldn't get through all the questions that was asked, but it definitely gives us a lot of things to think about as we think about our next topic and our next guest who will come in. So thank you so much for coming here. Thank you again, Dr. Hume, Ashley, and have a good night.